so then we're gonna make sure that we close the curtain.
Yes.
Okay.
Okay, and then I'm gonna raise the bed up. Okay, Mrs. Stone, just don't be worried. You're going for a little ride.
Oops, a doozy.
Yeah. And the other thing you can do is you can raise the head of the bed just a little bit, but it's not a requirement.
Yeah. Okay.
All right? Now we're gonna put the side rail down.
I'm being recording.
All right? And we're gonna turn her head a little bit to the side. Okay? Just
She
like that.
send it to me.
Now, I use a towel. Sometimes you'll see people using another barrier, like this one, but it's not necessary. And I should have brought the lip balm. Oh, I did. Yay. Okay, so what we're gonna do is you're going to verbalize that I'm going to make a 50-50 mouthwash water solution. Okay, so half mouthwash, half water. All right?
Because the Listerine is too strong for them?
Yeah.
Oh, it's really strong.
So like normal ones right now would be too strong for them.
Mm-hmm.
But it's fine for us.
Yeah.
Wow. Ooh, this is hard.
Okay, so these are called toothettes or sponge swabs or tooth swabs. I don't recommend ever using the lemon glycerin ones because they taste horrible.
Oh, really?
Okay.
Pink ones.
Yeah. Okay, and so you're gonna put this right here by her mouth. It's not gonna fit perfectly
Yeah. of course.
because she's a mannequin.
Right.
All right? And now what we're gonna do is we're going to put the tongue blade, padded tongue blade, okay? It's
Okay.
gauze and tape wrapped around a tongue depressor. Okay, so you put it in sideways and then you turn it crossways. So it goes into their mouth like this, and then you're gonna turn it like this and they can't bite down,
Keep their mouth.
okay? It's gonna keep their mouth open. So you can't really do it on the mannequin, so I just leave it on the side of her face just so I remember that it's there. All right, now,
Even if they open up their mouth, like trying to remove it, it won't.
they're unconscious, they probably won't.
Yeah.
Okay, so this is just how I do it for doing it on a mannequin. It's because I'm gonna leave it here so I don't forget it. Now you're gonna dip a sponge swab in and you can squeeze it out or you can squeeze it along the edge of the cup. Whatever, you need to squeeze out the excess because we do not want her to aspirate.
Yes.
We don't want her to breathe in the mouthwash. Okay, so I'm gonna do one side, outside of her teeth, and then her cheek. And put it in here. Okay, squeeze it out. Do the other side in her, do her teeth. I'm gonna do the roof of her mouth. You wanna clean the whole mouth.
Oh, yeah.
Okay, and then I'm gonna clean the front of her teeth and then her lips. And last but not least, I'm going to clean her tongue. Don't go too far back because they have a gag reflex still. Okay, so then I'm gonna clean her tongue, okay?
Yeah.
Now I'm gonna remove this. Okay, you can dump this in the sink, it's just gonna be right there.
Okay.
Okay, these things all go into the trash. And then, okay, Ms. Jones, I'm gonna put a little bit of chapstick on, okay? Now, I usually just put it on my finger and then put it on her lips. But if it's hers, you can just do it directly.
And if she kind of wet before that, dab it with the washcloth or
Yeah.
something? That's why
Okay.
you got your cloth. Okay.
Yeah, so, if you got any
Yes.
mouthwash or something on the outside, you're gonna pat it off. Okay, so then we're going to remove this, and this goes into the linen, which I
Linen,
probably have
yes.
over there. All right. So into the linen hamper, all of this goes into the trash.
Yes.
And these are probably her personal things. So all these would go back into her drawer. So we're gonna verbalize, I'm gonna clean and return my equipment to the proper area. Okay, this goes in the trash. Along with your gloves. Now I'm going to leave her head elevated a little bit and her head turned to the side just for a little while longer to let anything that is actually in there drain out. Okay, and I'm gonna lower the bed.
And you'll be able to walk around the room.
Okay, so this is trash, this is hers. All right, Mrs. Jones, I'll be back. Okay, so I'm gonna open the curtain, wash my hands, record, and report.